My name is Dr. Jacob Lane. I wanted to come on here and tell y'all why I became a chiropractor, why I'm starting this channel, and what my goals are for coming on here. I was first introduced to chiropractic back in high school. I was playing basketball and actually injured my low back. So I had a severe hyperflexion injury. So basically, my head went to the floor while I was still standing. And this happened while I was going up for a rebound, and someone came over the top of me and I ended up fracturing my low back. I fractured L4 and I had a bulging disc because of this. I was in a severe pain for a lot of time. My brother was actually in chiropractic school at the time, and he told me that I should go see a chiropractor, see if they could help. So the chiropractor took x-rays and he saw that I had a fracture in my low back. And he was like, "We can't start working on this until you get cleared by a surgeon to make sure, everything's stable and everything's good." So I went to the surgeon and he told me everything was fine. There was no surgery that they could do and that everything was just going to heal on its own and that it would be good. So I listened to that and tried to let everything heal on its own. And I thought it would be out of pain. I was really young at the time and it ended up not healing and things just weren't getting better. I was still in a ton of pain. I couldn't play basketball. And there was just a lot of things that I wasn't able to do anymore. I ended up going back to the chiropractor and he took some more x-rays, saw that everything was stable, and I started getting adjusted. At first it was very light adjustments, no, twisting or cracking or popping, and I was slowly getting better, but I was still having some pain on and off sometimes. So I ended up going to a few different chiropractors. I found a very specific technique that worked really well for me, and it helped a ton. It was great. It was so good. And after all this time, I was in a lot of prayer. I was frustrated with God, and I didn't understand why I was in so much pain at such a young age. And after finally getting relief and finding something that worked for me, I was really praying about what the Lord had for me and what He wanted me to do. And in this time, He revealed to me that I fractured my back so that I could be led to chiropractic. And I think that's been so cool and such a cool story for me to experience. I'm so grateful that that happened. And I'm able to now relate to a lot of my patients in severe pain with their low back and different things like that. So my brother was in chiropractic school in Dallas, Texas. He didn't love the school. It just wasn't. He didn't feel like it was the best option. So he told me to look into a few different schools around the nation, and I ended up finding Sherman College of Chiropractic in South Carolina, and I ended up choosing this school for many different reasons. But I went there, and I graduated. During that time, I learned a ton about chiropractic. I learned a ton about the body, how the body was made to heal itself, and our body's intelligent, and all these different things, how to take care of patients. And also in this time, I ended up meeting my wife. So I met my wife in chiropractic school, and she had suffered from a lot of concussions and a lot of head and neck injuries playing soccer and lacrosse, and chiropractic is what helped her. So she actually had her last concussion while she was in school, and we were together right after that. We weren't together whenever she had the concussion, but soon after that was whenever we actually met and started dating and got together. But during this time, I saw her suffer from severe migraine, severe chronic pain. She ended up having pain all over her body where she wasn't able to even wash her hands because things were so painful. Brain fog, fatigue. She had to spend most of her days in a dark room. She had a hard time focusing. She couldn't remember things and just was not in a good spot. So after going to multiple different chiropractors, we finally found someone that was able to help her, and we found that she had something going on with the upper neck. And we knew that upper cervical chiropractic was great and how good it was. She actually came in knowing that, and that's what she was taught from the beginning. But there's different techniques within that, and we finally found one that was really able to help her and get her going in the right direction, and she got her life back. And because of that, I saw this huge change in her where she was able to come back to normal and she was able to do normal things. She was able to, wash her hands again. She wasn't spending every single day in a dark room and was no longer in that severe pain all the time. After seeing this, I realized that this is a patient population that is severely underserved. So, this migraine, post concussion syndrome, craniocervical instability, multiple sclerosis, these different neurological conditions that are very complex and very severe. are very underserved and they aren't always well taken care of. There's always going to be different treatments out there for everyone, and not everything works for everyone. There's no one cause, one cure for any sort of health condition. But I know that upper cervical chiropractic can help dramatically with a lot of these neurological conditions. So after seeing this change in her, that's what made me want to get into upper cervical. So we spent the rest of our time studying upper cervical and learning about the body, learning about the upper neck and how important it is, and all the structures and all the things that it can affect. And we still have a lot to learn, and there's always going to be more to learn. Every doctor out there should continually be learning and learn more and more about their patients and the body so that they can better help their patients. But that's why I got into upper cervical, and that's why I got into chiropractic. And so I'm super grateful for everything I've learned and that I'm going to continue to learn. So I'm going to be talking about upper cervical chiropractic and how the upper neck affects different systems in the body, and how we're able to help those and how we're able to correct what's going on in the upper neck so that we're better able to serve our patients.